February is Cancer Prevention Month, so it really gives us an opportunity to help raise awareness for different cancers. And today, we're specifically talking about bladder cancer. And I'm joined by Dr. Sridhar. She is a medical oncologist. Welcome to the show, Dr. Sridhar. And let's talk about bladder cancer first of all. How prevalent is it?
Sure. So, bladder cancer is the fifth most common cancer in Canada. In any year, it's about 12,600 people will be diagnosed with this disease, and sadly, about 2,600 people will die. So, it's a really significant problem in society.
What are some of these signs and symptoms of bladder cancer?
Good question. So, probably the most important sign of bladder cancer is seeing blood in your urine. So, in people who do see that, I encourage them strongly to see their doctor early, and get it sorted out, get it investigated. It's a very subtle sign, but it's really important that when you see that you do go see your doctor. There are other things that blood in the urine could symbolize or signify, but it's really important that it gets checked out. So that's one of them.
Yeah, yeah,
You know,
absolutely.
the other type of side effects include things like urgency, where you have to go to the bathroom quickly, frequency, you're going often. And then there's other things like decreased energy, decreased appetite, and weight loss. Those are some of the things to watch for.
Certainly important before any of those things even occur. Those signs and symptoms is prevention. So, what's some advice you can share for viewers out there to prevent it?
Yeah, for sure. It's Cancer Prevention Month, so it's really important to remember what are the risk factors for this disease, and the most important one is smoking. So if you're a smoker, please try to cut back. Please try to stop. And if you haven't started, don't start at all. That's probably one of the biggest risk factors for this disease. Although there are also non-smokers who can get this disease, so it's important to be aware of that. It is a disease that tends to affect people who are a little bit older. So again, it's important to
Okay.
watch for those symptoms. That's probably the biggest two things to think about.
Yeah, and I think it's fascinating oftentimes when we think of smoking, something like lung cancer and throat cancer and that sort of thing comes to mind, and people don't necessarily, have that connection between, well, my bladder and smoking. How is that possible? But something like that, right, just affects really every part of your body, doesn't it?
Yeah, absolutely. That's a great point. It's something that we don't think about. You think about other smoking related cancers, but you don't really think about bladder cancer. So it's really, really important to be aware.
I think something else that's interesting, Dr. Sridhar, is the fact that it's one of the most expensive, if not the most expensive, cancers to treat. Why is that exactly?
Right. So in early stage disease, what happens is despite having the tumor in the bladder removed, it has a high chance of coming back. So it comes back frequently. And so that means that patients need to be monitored on a regular basis every 3 months to have a camera go in and look and make sure nothing is coming back. And so that accounts for some of the costs associated with this disease.
What is the latest research when it comes to actually managing? So you've had the diagnosis, and now you're in a situation where you need to manage the disease and obviously have it treated. So maybe we can talk about management and the treatment options available out there.
Yeah, absolutely. So I think I'm optimistic because there have been a lot of very positive advances in this disease over the last 5 years or so. And that's really large credit goes to the patients who participated in clinical trials. In advanced disease in the frontline setting, the standard of care is chemotherapy. That's still really, really good, a good place to start. Beyond chemotherapy, we now have immunotherapy, which is when the body is trained to better recognize the cancer. And then third, and we just have a new option, that's a targeted type of chemotherapy. It's called an antibody drug conjugate. It's called Padcev is a new drug, and it targets the chemotherapy right to where it has to go. So we're really lucky to have a number of new options to treat this disease. It's helping us to have patients live longer and probably live better as well.
Funding for a lot, when you think of cancer, there's so much funding that goes into research. For bladder cancer. I'm wondering, we don't hear about it very much. Is the funding there? I mean, if people are looking to support more research, what does it look like at the moment?
Yeah, I mean, it is a cancer that we don't talk about as much as perhaps other cancers, and it's one that's desperately in need of funding just so we can continue some of the advances that we've been making over the last few years. Bladder Cancer Canada has an excellent website and even opportunities to contribute to the research, help us to continue to make these advances. And so I think that's going to be really important for people to think about this as a cancer that needs to be funded to make these advances and move forwards.
Absolutely. Dr. Sridhar, thanks so much for joining us. Really appreciate your time today.
Thank you so much. This is an important cancer. I'm so glad we're talking about it today.
By the way, we brought up that website, but I'll just remind everyone it's www.bladdercancercanada.org to find out more information. Don't go anywhere, because if you're like me, you may be wearing one of these trackers for your health. How much information is coming out of that?